there is new modelling data showing that the progress made in reducing cases has leveled off. Ontarians are being warned that how well we follow health guidelines and control the spread in the coming weeks will determine the quality of our summer. Matt Ingram is following that story and joined us live with more. Matt.
Taz, one of the top doctors from the COVID Science Advisory Table, says the last year has shown preventing the rise in cases is easier than flattening the curve, warning people to follow health guidelines or we may face a third wave. Dr. Adelstein Brown and Dr. David Williams presented the province's latest modeling data today, which shows cases of variants of concern are rising and overall cases are on the rise too, as more and more people are leaving their homes and going out into the community as restrictions decrease. He says the risk of being exposed to the disease is up, as well as the risk of catching it. 24 out of Ontario's 34 public health units have seen an increase in case rates over the last 2 weeks, including here in Hamilton, Halton, and Niagara. And he says 14 public health units have seen growth of more than 30%.
This growth isn't random. It's a function of how loosening public health measures, increased mobility, and growth in new variants come together. Some of our largest communities that maintain strict public health measures have kept cases flat or seen cases drop. But cases are rising in other communities, and our cases are now substantially above their level 2 weeks ago. This means that we still face a very risky situation.
On a positive note, the data shows vaccinations at long-term care homes have paid off, with staff and resident cases continuing to decrease and the death rate flattening out. The province says there have been no resident deaths in the last 5 days.